Now our team coverage of the hot and humid weather continues this afternoon. An air quality alert is in place for the entire state. So what does that mean for you and for everyone's health? Joining us to talk more about it is Ruth Canovi, the Director of Advocacy in Connecticut for the American Lung Association. Ruth, thank you very much for joining us today.
Thank you for having me.
Well, I think people hear about these warnings and they aren't really sure what to watch out for. What signs or symptoms would we want to keep an eye out for if there were an issue that we're having because of the air quality?
Yeah, that's a good question. So the signs and symptoms that air quality is affecting you really are not one size fits all, right? Like so many things that we encounter. They can range from feeling a bit tired to having a severe asthma attack. And so in Connecticut, one of the main pollutants we're concerned about, especially over these summer months, is ozone. And when ozone is inhaled into the lungs, it causes inflammation in several different systems of our bodies, with many people experiencing breathing problems such as like chest tightness, coughing, shortness of breath. And so more severe cases can include cardiovascular effects. And a lot of people are at risk for poor health outcomes on days that we're expecting poor air quality. And so as with anything, we always encourage people, if they're concerned for their health, to contact their healthcare professional as well.
I think a lot of what you're talking about certainly impacts some people more than others, but obviously, you know, on a really humid day, a really hot day when the air is really thick, that can have an impact on everybody, even a healthy person who wants to maybe go out and go for a run. It may not be a good idea, right?
Right. And so, I mean, really anyone who spends time outdoors when ozone pollution levels are high may be at risk. Some people do face higher than average risk, however. And so research has shown that the groups at greatest risk for poor health outcomes for ozone pollution include children, anyone age 65 and older, people with existing lung disease such as asthma and COPD, and then also people who work or exercise outdoors. And so there's definitely things that we can do to try to keep ourselves healthy and safe on these forecasted poor out.
Yeah, for sure. I want to ask
air quality days.
Yeah, no, absolutely. I understand. I guess before I let you go, I'm curious, what advice would you give anybody when it's like this?
Yeah, absolutely. So I think the first thing that we recommend is that people stay informed, right? And so we encourage people to watch those weather forecasts, listen to the radio, try to get their weather forecast because often these things are forecasted on this. The website airnow.gov also has great information that includes what the forecasted air quality is. But then we also encourage people, if that is the case, maybe stay inside if they can, or even avoid exercising at those really high times of day. So if they can exercise earlier in the day or later in the day when the air quality might not be so bad, and also avoid exercising near high traffic areas, because even when air quality forecasts are green, vehicles on busy highways can create high pollution levels up to just like even a third of a mile away. So we want to try to make sure that people stay safe and healthy during these high ozone days.
Oh, a lot of great information. Ruth Canovi from the American Lung Association. Thank you very much for joining us this afternoon. We appreciate it.
Thank you so much.
All right.